Hi, everyone. Welcome to today's session. I'm Deanna Paulin, Director of People and Culture here at New South Wales Health Pathology, and incredibly excited to be the chair of this plenary session. So closing the healthcare gap is a vital role health agencies and partners are determined to achieve. Here at Pathology in 2020, we launched our first Innovate Reconciliation Action Plan, or RAP for short. And our RAP formalises our wholehearted commitment to building respectful relationships with Aboriginal and Torres Strait Islander people and achieving meaningful gains in closing the health and justice gaps. Our RAP also articulates our support and commitment to research. Research in Aboriginal health is essential to help us in closing the gap and is an area that desperately needs more attention and focus. So our plenary speaker today has had a colourful career with a passion and wealth of knowledge in Aboriginal health research. He's going to tell us a little bit more about himself shortly, and I can't wait to hear him share his experiences and his insights with us today. So I'm incredibly pleased to welcome the Director of Aboriginal Health at Southwestern Local Health District, Nathan Jones. Welcome, Nathan.
Thank you, Dee, and thanks everybody for having me. Do you mind just going to the next couple of slides, please, Dee? So thanks everybody for having me. I'm here to talk about our research journey over the last 10 or so years, and I guess share some of that knowledge, hoping to inform the work that happens across not only pathology, but all of the different sort of stakeholders and services that are here today. Next slide, please, Dee. So just before I start, I want to acknowledge the traditional owners of the land. Obviously, we're coming from all across the state and potentially further afield. But for me today, I'm here in Liverpool. So I'm on the land of the Cabrogal people of the Darug Nation. So I just want to pay my respects to elders past and present, and extend that respect to everybody that's on the call. So like I said earlier, I'm Nate Jones. I'm the Director of Aboriginal Health here at Southwest Sydney. Born and raised in Southwest Sydney, so this is home for me, but I guess my traditional connections are to the north coast of New South Wales, up around Bundjalung country, but feel very privileged to have been in this role for a period and to live and work in my community. I've worked in Aboriginal health for the last 20 plus years, and about 10 of those have been in this role. Prior to that, I was working with the Commonwealth Government with the Office for Aboriginal and Torres Strait Islander Health. So really what I was hoping to do today is just talk a bit about our research journey here in Southwest Sydney. I think it's just as important to talk about what we've been successful at, but also some of the mistakes and how we've learned. But to give you some good context, I also want to talk a little bit about our service and also the region we work in. So next slide, please. So there you'll see a little infographic that gives you sort of a picture of Southwest Sydney. So we cover the boundaries of 3 traditional Aboriginal nations. So in the northern part of our area, it's the Darug. In the southern part, it's the Gundungara. And then around the Campbelltown, sort of Wallandilly part is the Dharawal. One of the things that we're really big on here in Southwest Sydney Aboriginal Health is making sure that we have good perspective about our shared history. So that means understanding our traditional communities, but also our contemporary communities. Also understanding our colonial history, and how that shapes what our Aboriginal communities look like today in Southwestern Sydney. One of the stories we particularly that is particularly significant for our communities here in Southwest Sydney during that colonial period is the Appin Massacre, where a number of Aboriginal people were killed out at Appin as part of a government process at the time to clear land and sort of quell a bit of an Aboriginal rebellion, I suppose. It's still something that's very significant to our community out here, and it's something that we actually have a ceremony and a specific acknowledgement every year annually. But understanding that history and understanding that historical context is really important for the work that we do. Equally important is understanding our traditional communities as well, but also our contemporary communities. So Southwest Sydney, most of the people that live in our region will be Aboriginal people that have come from further afield. So as different government policies progressed, we had a large number of Aboriginal people rehoused in our area from traditional Aboriginal nations from all over New South Wales, but also from all over the country. So that means we've got very diverse communities out here in Southwest Sydney. A lot of those communities were set up around the large social housing estates that developed, particularly around places like Aids and Green Valley, Villawood. So that's where a lot of our communities developed and evolved over time. But that's changed again with Southwest Sydney as a lot of those social housing precincts have been redeveloped. Another key part of our story here is about the large Aboriginal organisations that are in our patch. So we're very privileged to have 3 of the biggest Aboriginal organisations in the state in their different areas, and in a couple of cases, actually the country. And these are organisations that our organisation has a very close working relationship and actual formal partnerships in place that guide and support a lot of the work we do, not only in Aboriginal health, but also in terms of our mainstream services. So those organisations are Thurl Aboriginal Medical Service, Gattingara Local Aboriginal Land Council, and Kari Aboriginal Resources Incorporated, which is actually an out-of-home care provider and the largest one of its kind in the country. So we have formal partnerships with each of those organisations. They're immersed in our governance structure. They're connected to our Aboriginal Health Committee of the board, and they're really pivotal to the work that we do. Our population, so we have one of the larger Aboriginal populations of any of the local health districts in New South Wales. We have the largest Aboriginal population of the metropolitan LHD, so we have over 20,000 Aboriginal people in our patch. The only local health districts with larger populations are Hunter New England, which covers a massive tract of land, and similarly far western New South Wales, which is also a big patch. Next slide, please. So I talked a little bit about our area, our region, our communities, I guess a bit about the service. So we've got probably close to 100 staff attached to our Aboriginal Health Service out here at Southwest. And we have a number of specific teams in child and family, chronic care, mental health, drug health, our hospital Aboriginal liaison officers, population health, the violence and neglect space, and we also have a Respecting the Difference team. So we've got a very large team, and our services are a mix between culturally specific programs where we have Aboriginal teams with health workers and clinicians that work in partnership models servicing our communities. And the other model we have is where we have Aboriginal health workers or identified positions embedded with mainstream services that are supporting non-Aboriginal clinicians that work with Aboriginal consumers and their families. The last few years for us, and this is what a lot of our research is centered around, has been this big reform agenda where we've had a significant shift in the way that we deliver care and the way that we've structured our models. And the premise of that sort of reform agenda has really been around a few things. One is making sure that the services are Aboriginal-led. That ensures that cultural responsiveness happens from the top, and that real focus on the specific needs of our own community are embedded. The other big shift for us has been shifting the dynamic of our actual service models and having our clinical models sit within cultural frameworks. So it's not the other way around. What's happened in the past, or what's happened with a lot of our models, and I guess we've realised hasn't been effective as it could have been, is that they've been clinically led, and often the role of the Aboriginal health worker or the cultural components of the program have been an add-on, and they kind of come after a lot of the clinical intervention. We've found that hasn't worked for us, and what we've seen is much more significant success around having cultural frameworks with clinical services embedded within those. And what that essentially means is that it's a much more patient-centered approach to service provision. We're really looking at the specific needs of our clients, their families, the context that they live in, exist within, a big thing for us is understanding Aboriginal family structures and how to navigate those, the relationship to our broader communities, and the role that Aboriginal services play. So that's been a lot of our work, and a lot of our work has also been around evaluating and researching the impact of those models, and we'll talk a bit about that as we go. Next slide, please. So I sit in the Aboriginal Health Unit, which basically oversees our Aboriginal Health Service. So we oversee all of the specific programs that are attached to Southwest Sydney, as well as a lot of the work attached to the mainstream organisations. We have a particular role in supporting our workforce. So that's both our Aboriginal identified staff, but also the non-Aboriginal clinicians and health professionals attached to our services. We have some particularly unique structures out here in Southwest Sydney that are really built around ensuring and supporting our workforce to make sure they're culturally competent. A particular feature of our model is cultural supervision, where we engage external cultural supervisors for both our Aboriginal identified workforce and our non-Aboriginal workforce to provide support, advice around service provision, to encourage reflective practice in terms of the way that they deliver care, and to support them around maintaining some core competencies, ensuring their practice is culturally safe. Like I mentioned earlier, a lot of the work we do is collaborative. So we have a multitude of collaborative clinical models with those partner organisations I mentioned earlier. So virtually every specialist outpatient clinic you could think of, we have with an organisation like Thurl Aboriginal Medical Service, from paediatrics through to geriatricians, through to endocrinology, psychiatry, respiratory, cardiology, neurology, you name it. So we've got these significant investment in all of these collaborative clinical models with our partner organisations, but we also have mechanisms in place to support shared care. So where consumers are accessing services both through the local health district and through our Aboriginal partner organisations, we have governance structures that support coordination, engagement and referral. And it's a big part of the way that we do our business. And lastly, a lot of the work that happens in my unit is also working with our mainstream services to improve their cultural responsiveness. And particularly the way that we do that is through our governance structure, which I'll talk a little bit about as we go on. Next slide, please. So just some key principles that underpin everything we do. And I just want to make mention that a lot of these principles don't only flow over into the way that we deliver our services, but they're also very applicable in the way that we approach our research as well. So a big one for us, and I guess this is why I told that little yarn at the start, is about that context for our community and understanding how they've evolved over time in that history, but understanding the impacts of colonisation and also the significant impacts of transgenerational trauma, which from my perspective are a significant factor in the disparity in the health status for our communities. For all of our service models, we have this focus on making sure that they're culturally responsive. So again, that little yarn I told about how we've shifted our service model. Sorry, just accidentally muted myself there. So just how we flipped those models around and had that shifted dynamic around culture as the framework and embedding our clinical models within those cultural frameworks. We appreciate the diversity of our Aboriginal cultures and understand that we have people in our area from a range of traditional connections, communities, and a range of people that have been impacted in different ways around colonisation, which really shapes the way that they engage and connect with health services. We have a strong focus on understanding our families and their kinship connections and how we work with our Aboriginal families in a holistic way. That's a big one for us about this holistic approach to service provision. So really thinking beyond our sort of clinical silos and the way that we deliver care and making sure that all of our program models look at clinical, psychosocial, and the cultural needs of our families. We've tried to shift from a deficit approach, and I think that's a lot of the sort of narrative that you will hear in Aboriginal health is about our deficits and our challenges, and there's not enough discussion about our strengths. and the areas that we're doing well. Like an obvious area for me is the Aboriginal sort of primary healthcare model, which is very much about patient-centered care and holistic approaches to service provision, is something that the mainstream is now really trying to shift to. But ever since we've started, we had the first Aboriginal medical service set up over 40 years ago. It was the fundamental principle that underpinned everything we did. And the other one that's really critical to us is collaboration and understanding our particular service models often are based around having Aboriginal health workers and clinicians that work in partnership. So there's that internal partnership for all our services and programs with our Aboriginal identified staff and our non-Aboriginal clinicians and our Aboriginal clinicians as well. But also that then extends to the way that we work with our partner organisations and service communities. Next slide, please. So, look, not the most exciting infographic here, guys, but it's important because it just talks about our governance structure. And hopefully what it illustrates is the reach of Aboriginal health across all spheres of our service. So for us, there's a really critical committee we have at the top. We have an Aboriginal Health Committee of the board. Sitting beneath that are our formal partnerships with each of our Aboriginal organisations, and each of those organisations have a seat on our board. And then what we have is a series of Aboriginal health committees across all of our services and facilities. So every hospital in our district and every service in our district has an Aboriginal health committee, which brings together the executive of the Aboriginal health unit and the facility or service executive. And that's where we really set our agendas around service provision that is specific to meeting the needs of our Aboriginal communities. So we look at where we've got dedicated Aboriginal programs or services. We look at parts of the system that aren't meeting the needs of Aboriginal people and what our response will be. An obvious one for us at the moment is our challenges in emergency and the poorer outcomes we have for Aboriginal people around completing treatment in emergency. But this governance structure drives all of our service provision and also our research work as well. For most of these program areas where we've got a service model or program, we've also got some research activity that's really looking at evaluating its impact. Next slide, please. So just a couple of things, and I think this is important for me and for you guys, is just to understand research from an Aboriginal perspective. So obviously, Aboriginal Australians are known as the longest continuing culture in the world. And we've been gathering data, analysing, recording and sharing the results of our research since our time began, but through a very different way, I guess, than what our modern researchers do. And that was through story, song, dance, painting, our songlines and dreaming. Colonisation has obviously had a very significant impact on the way that that knowledge has been transmitted from generation to generation, but there is a very active agenda to sort of recapture and revalue a lot of that traditional knowledge. Early colonists recorded our beliefs through agricultural practices, our language, the way we lived through their lens, and it was often misinterpreted and misunderstood. Where people did take the time to listen and talk to our ancestors, there have been many conflicting records, and it's only now that Aboriginal people are finding their voice and changing those records and that history. One of the big things for me is that a lot of the research that's happened for our communities has been driven by different agendas and unfortunately hasn't contributed to improving health outcomes or other outcomes for our community. So I think what you'll find is often when you talk to Aboriginal communities or organisations about research, they can be guarded or they might roll their eyes a little bit just because we've been down this path so many times where been researched, had all this work done, but then in terms of the actual benefit or the outcome in terms of that actually informing meaningful change, it hasn't happened. So a lot of that research has come from that deficit perspective. And that's where we really need to shift the dynamic. And that's where I guess is the call to action for all you guys as researchers is to really think about the approach to research we now take with Aboriginal communities and making sure that it's much more collaborative and that it's meaningful and driving significant change. So that focus on translational research is really critical. Next slide, please. So for us, like I said, having had the benefit of being here for a little while, we've learned a lot of lessons about what has and hasn't worked in the research space. And I guess alluding to that earlier point was about over time, I think one of the things I've had a lot of experience with is people approaching me with pieces of research that I guess are driven by, different agendas. I guess I call it niche research that might be an interest for a person or a specific area of focus, but it's not going to result in meaningful changes to service outcomes or practice for our community. So we've been very strong in being clear about any research priority in our district needs to be negotiated collaboratively with Aboriginal people and needs to relate to our priorities, not just a research priority by somebody that they've identified. Also had an experience where there's lots of big research projects who, as an afterthought, think that it's a good idea to include Aboriginal people in the process because it might add some, might add a little bit more emphasis to the research project or add some meaning to it or, whatever it might be. And we're added on as a bit of an afterthought and it's a bit of a ticker box exercise. And I'm often approached about, can you help me get ethics for this so we can analyse some specific data for Aboriginal people? Again, that principle about engaging with the community, making sure that the research is focused and it's translation, we're going to make some meaningful outcomes for our communities. The importance of engaging Aboriginal people at all stages of the process. Again, we've had experience where we've been brought into research projects at a later stage, and because the consultation and the engagement process wasn't well set up, your results and your data are very skewed right from the outset. So we've had to work around that. Similarly, where we've brought in later just for where we haven't been engaged and the data analysis hasn't involved Aboriginal people to provide some context to it. That's also been challenging, and it's resulted in some inappropriate conclusions being drawn without the right context. And again, it often adds to that kind of deficit perspective, which we're trying to get away from and much more focus on our strengths as an Aboriginal community. So for us, what we've done over time is we've been much more selective in the research that we engage with and support. And we've developed a set of principles that really inform that. So next slide, please. Sorry, next slide. Yep, here we go. So just in terms of those principles, really important one is to acknowledge that previous research context for Aboriginal communities. So it's understanding that you might get some mixed reactions when you're engaging with Aboriginal people or organisations around research. It's important you've got that context that there has been so much research done in our community that hasn't been effective, hasn't been meaningful, hasn't been well designed. So I think that's just appreciating that context and making sure that you go in with that understanding so that you're informed about why it might take a little while longer to negotiate around different research projects. So important that the priorities are locally driven and they're specific and relevant to our communities. So we're working on making sure that we've got a local agenda that matches with what we're trying to do in terms of our services, that matches with what our community is telling us in gaps, but also matches with what the data is telling us in terms of parts of the system that aren't meeting the needs of Aboriginal people. A big priority for us is building the capacity of Aboriginal researchers. Obviously we need to grow our Aboriginal research capacity. So we need to have Aboriginal people working closely along experienced non-Aboriginal researchers to build that capacity and to inform that work. We want to make sure that all our research is translational and supports practical change to the way that we deliver care or services. And we absolutely want to make sure that Aboriginal people are involved in the process of analysing data and its interpretation to ensure there isn't any miscommunication or misinterpretation of results. Next slide, please. So hopefully all you guys will be familiar with this, and these principles here, I guess, kind of align with the principles that we have locally, but these are the 5 key principles that you need to satisfy through the Aboriginal Health and Medical Research Council. So anybody that's conducted any research that involves Aboriginal communities would be aware that there is a separate ethics process, which is managed by the Aboriginal Health and Medical Research Council. They have a specific ethics committee that assesses any Aboriginal research projects and has a very robust process around making sure that the research is meaningful and is going to benefit our communities. And as part of your submission to that ethics committee, you need to cover off these principles. So one is net benefits for Aboriginal people and communities, that there's Aboriginal community control of research. A fundamental component of that aspect of Aboriginal community control is often you will need to supply formal correspondence from an Aboriginal organisation that supports the research and says they're on board because of these benefits. The research needs to be culturally sensitive, and that goes back to those earlier points about the way that we look at design and our process around assessing data and feeding back to community and all those sorts of things. Again, reimbursement of costs so that the involvement of Aboriginal people and organisations are recognised and there's some reimbursement or remuneration around that, and that the project looks at how it can build the skills and capacity of Aboriginal people, whether it be the research people that are involved, Aboriginal organisations that you might partner with, or community participants involved. But for any of your research that will be looking at Aboriginal communities, you will need to satisfy those 5 principles as part of the AHNMRC ethics process. Next slide, please. So our role in supporting research, so the Aboriginal Health Unit, I guess the specific things we do here in Southwest Sydney is that we assist with facilitation and connection to community, both in terms of organisations, but also community stakeholders. So we'll often help researchers do some of those initial introductions and build that connection. We'll often provide advice around the proposed research and whether we think it will pass muster with our community and how we can support them in terms of navigating that process. We will consult on the design of research studies, so the way that the project methodology is set up and the way that we look at the engagement strategy will help with communication around stakeholders. Something we've been doing more of is looking at supporting our researchers to think about culturally specific ways of gathering information and ensuring that the research has a cultural tone. So again, that's a bit about understanding the context for our Aboriginal communities. That's a bit about engaging Aboriginal people to support the engagement and research. And it's a bit about the way that we set up our consultative structures. So a lot of the recent research projects we've done is we've had yarning circles that have brought community people together to share their experiences in a very organic way. So obviously there are some questions, but we let the discussion sort of flow and go where it needs to, and then we bring it back at the end to some of those key issues. But I guess we're very cognizant of the way that Aboriginal people engage and connect, and we want to support that. Like I mentioned earlier, there's a lot of work that needs to happen around ensuring the analysis is appropriate. So we often support the way that the data interpretation happens and then how the feedback happens to our community. And that's really important. So when we gather information from our community, we want to make sure that there's that really strong loop of how we communicate it back and that we have a strengths-based approach to how we're sharing the outcomes. Next slide, please. So look, I won't go through all of these, but just to give you a bit of a snapshot of some of the research that we're involved in or have been involved in. Been fortunate enough to have a couple of translational research grants. So we've just a year or so ago completed one into an evaluation of the Aboriginal transfer of care model, which looked at a specific program we set up to support the discharge of Aboriginal patients from hospital back into the community, and making sure that we were addressing our unplanned readmission rates. We have also currently got a translational research grant happening at the moment of a metabolic clinic that we've transferred from one of our facilities into an Aboriginal community controlled organisation. So that's a clinic that supports people that are very, very obese at the sort of higher end of the obesity scale, and looking at whether there's an option around non-surgical intervention to support their late weight loss journey or surgical intervention. It's a very significant model, and we've transferred it in its entirety from an acute hospital setting into an Aboriginal community controlled health service. We've recently finished an evaluation of our Aboriginal Got It program, which is a mental health early intervention program looking at Aboriginal children at risk of conduct disorders as a predictor for mental health later on in life. And we've got a culturally specific program that works with the children and their families around unpacking a lot of those issues, supporting good parenting practice, and hopefully setting up those kids for a better trajectory later on in life. It's a really significant program because I guess it's our first piece of research that really looked at that principle of using a cultural framework and then embedding the clinical model in it. And the results we've had from that have been fantastic. We've got great measures across a range of indicators that actually show better outcomes in the mainstream version of the program for the kids enrolled. Next slide, please. So just a couple of other research projects that I'll mention. One that we've been involved in for a few years, and I guess relevant to this audience, is our screening emergency admissions at risk of chronic hepatitis program called SEARCH, which is basically a screening program where we looked at screening people as they came through the emergency department to identify whether they have or are at risk of chronic hepatitis. And then to support those people through the system to actually access hepatitis treatment. We've run it at Liverpool Hospital a few times, and we're now looking at extending it further afield in our district and in other districts. And a key focus of that research was around Aboriginal people, where we had a significant overrepresentation of Aboriginal people coming back positive for hepatitis, and then how we were supporting them navigate through the system. It's a great example of how we're using that screening methodology and that focus around pathology to support people then accessing care down the line that will hopefully help them address that chronic illness. And then probably just the last one I'll mention is at the moment we're involved with cancer services research project called What Matters to Adults, which is really looking at a specific patient-reported measure designed for Aboriginal people, looking at their well-being as they go through that treatment process. Well, our interest in this project, obviously we've got an interest around the well-being measure and its application, but also it came with a specific resource that enabled us to create an Aboriginal health worker position in our cancer services, which has been a gap for us. So research, again, that enables us to build service models and enhance our service provision is obviously very attractive. And we're hoping that at the end of this research project, we'll be able to maintain that Aboriginal health worker supporting Aboriginal people go through their cancer treatment journey. Next slide. So look, common themes underpinning all of our research, making sure that it's Aboriginal-led, that it's translational in terms of enhancing the way that we deliver our care and services, that it has a focus on looking at cultural and clinical components, and that our projects are collaborative, so that they're not just about the local health district running off and doing a piece of research, but we're working with our community, we're working with our various stakeholders, and importantly, we have our Aboriginal organisations on board. Next slide. So probably just one of the last things I want to mention is a big thing for us in terms of where we move forward with research is that we have an academic health partnership set up for our organisations between us, Western Sydney University and Thurl Aboriginal Medical Service. And it's really about all that stuff we've been talking about earlier, guys. It's about building Aboriginal research capacity. It's about setting up our own research agenda to ensure that it's driven by Aboriginal people and to ensure it's addressing real health need for our communities. And there is a focus on building the responsiveness and cultural competence of our mainstream services and our clinical workforce. And I think we're up to the last slide. So just our vision moving forward for us is that we really want to have that academic unit fully operational. So the partnership has been going for a couple of years, but there are key positions that we still need to recruit to have our Aboriginal academic health partnership fully functioning. We want to have our own Aboriginal health research agenda that aligns with local need and community priorities, and we do that with our partners. We want to minimise our involvement in research projects that have peripheral value to our work. Unfortunately, there are probably still a couple of projects that are on the tail end of being involved in, and we want to transition that to much more of a focus on research that's meaningful for us in our communities. And then the last one is ultimately what we want to do is build a network of Aboriginal researchers here in Southwest Sydney. And I think that is it.
Excellent.
Open for questions.
Thanks, Nathan. So everyone who's joining online, you have the function to be able to pop some questions down into the Ask a Question section. I'm just going to stop sharing so that we all come back together. We've got a couple of questions coming through, Nathan. The first one is, I did something and then it's gone, so I'm about to answer. Oh, there it is. How can researchers that want to include Aboriginal communities in project planning best get in contact with the right people?
So for me, a good start would be through the Aboriginal health services attached to local health districts is one opportunity. So if you're attached to a local health district and you're working on a project, I think reaching out to your Aboriginal health unit or Aboriginal health service is a good starting point. Equally, approaching Aboriginal community-controlled organisations is a good approach as well. What I will say about that, though, is that our Aboriginal community-controlled organisations can often get inundated by research requests. So it'll just be a little bit dependent on how responsive they are, because all sorts of people are approaching them about all sorts of projects. These are organisations that aren't set up specifically around research functionality, often are under-resourced for the service provision that they need to provide to their community. So I guess it's just been a bit respectful about that. But if you're attached to a local health district, I would suggest your first port of call would be your Aboriginal Health Service.
Fantastic, thank you. Next question is, if the research needs to be translational and support practical change, does that mean that that basic science is not very attractive for Aboriginal communities?
No, not necessarily. Like I think it depends on the way it's framed and the issue it's attacking. Look, translational can take many forms. If it helps us understand an issue or a problem in a better way, and then over time develop different responses, absolutely. But I think what we want to get away from research in the Aboriginal space is research for research's sake that doesn't contribute to improving health outcomes for Aboriginal people. I think we're probably all very cognizant and aware of in this setting about the disparity in health outcomes for Aboriginal people. And I think that is the perspective of Aboriginal communities and organisations, is that a lot of research that has happened over time hasn't benefited or improved outcomes for us or provided us with new knowledge, or been done in a way that supports Aboriginal communities to take various issues forward.
Yeah, fantastic. Thank you. I also had a question that I jotted down. I hope I can ask. I was really interested when you talked about looking at other or culturally appropriate data collection methods or engagement tools and techniques. You touched on yarning circles. Are there other examples of culturally appropriate data collection approaches that you could share with the group?
Yeah. I think one that we often use is, and look, this is probably sometimes a challenge for my workplace, but often we utilise our Aboriginal health workers or clinicians to support engagement. So in their routine engagement around care, because so many of our research projects, qualitative components are such a big part of a lot of the research we do. So the way that we utilise our Aboriginal staff to support that engagement and support people to feel comfortable to share their story. Again, that's really important too, in terms of getting good, honest, robust feedback that's meaningful. So the utilisation of Aboriginal people to support that connection and engagement, and the way that you pace your connection and how people share their stories is also really, really important, and not rushing that process. Often research projects will work into these, very specific timelines, and we want to pump through a heap of stuff. But for us, you need to develop trust and relationships with our community if you really want to get the right story.
Fantastic. And last question, if I can ask one more. And you shared, it was great, the slides we shared some of the research that's underway and you've been involved in. What's been your favourite research project, or one that you think has had the most impact or seen most meaningful change as a result of?
Probably my favorite. Well, yeah, like a couple, but the one that I'm most proud of is the evaluation of the Aboriginal Got It program, only because we won a pilot to do a cultural adaptation of a program, and we were able to really build our evidence base, showing that we could do this, and that culturally led models have different outcomes for our community, and we could demonstrate in terms of both the qualitative and quantitative data about the difference our approach had to the mainstream service for Aboriginal people. And there was a marked difference. Like, it wasn't a little difference, it was a very significant difference. So I feel like that was my most favorite in terms of really saying, guys, you need to invest in this approach, and we need to think about the way that we deliver care to Aboriginal people and the importance of having culture at the centre of all our models.
Excellent. Nathan, thank you so much for joining us today, and an excellent presentation. And for me, a really clear call to action for this group, and for all of us joining today, that is that we need to challenge ourselves and our approach to research with Aboriginal communities so that it's translational, that it results in meaningful change to service delivery and meaningful outcomes for Aboriginal people and communities. So I really thank you for your presentation and that call to action.
All good. Thanks for having me, guys. Appreciate it.
Brilliant. So we've come to the end of this session and to our next break. So we have a break now until 4:30 this afternoon. So hopefully you'll come back and join us for our second plenary session. International speaker, Professor Giuseppe Lippi, chaired by Dr. Emmanuel Favaro. So we'll see you all at 4:30. And again, a big thank you to Nathan for joining us today. Have a great rest of the day.